wondered why you hear of so many women in your life that have Hashimoto's, but not as many men? Let's talk about why Hashimoto's thyroiditis, which is a type of autoimmune disease that affects the thyroid gland, is more common in women than it is men. So what is Hashimoto's? Hashimoto's is an autoimmune disease. So it's where the immune system, it's not necessarily your thyroid, but it's where your immune system attacks your thyroid gland. So it's like the thyroid is kind of the meek, timid little kid on the playground, and the immune system is bullying it. So this causes the thyroid to become inflamed, damaged, and it will really significantly lower production of thyroid hormones. And so many symptoms can creep up because of this: fatigue, weight gain, depression, joint pain, muscle ache, so many things. So why are women more likely to have Hashimoto's than men? Because it's really literally up to like 8 times more often than men. There are several things that contribute to this whole phenomenon, and that includes hormonal changes. We go through so many hormonal changes than men do. Family history, genetics being passed down, and then there's a lot of environmental factors that play a huge role. So hormonal changes, we have them throughout our lives. Puberty, pregnancy, menopause, these increase the risk of developing autoimmune conditions significantly. Yes, they do. Women are also more likely to have a family history of autoimmune conditions. It's just something that's been passed down generation to generation. And so women might be more likely to inherit these genetic codes that increase the risk of any autoimmune condition happening. Also, the exposure to the environmental toxins and stress, which can be more common due to lifestyle and occupation. And I think it's increasing more because we're exposed to more chemicals in our day-to-day life, and women are almost expected to juggle more in life than maybe previous generations were having to juggle. So is there help out there? Yes. Treating Hashimoto's typically involves hormone replacement therapy, which many providers won't even implement until the thyroid gets so weak it can't produce the hormones. And I once had a client who I was working with who said, so I was just diagnosed, so I was working with her for her hormone imbalances, but she said to me, I was just diagnosed with Hashimoto's, and my provider, I asked him, well, is there anything I can do to make things better? And he said, well, no, we're just going to wait until your thyroid is done producing, and then we'll put you on medications, and then that will help. And she's like, well, I'm having symptoms. What can I do up until the medication is needed? So just nothing. In addition to medication, there is so much that can be done. Tweaks in your diet can make a big improvement. Regular exercise is huge. And then having good coping mechanisms with your stress management. These all help improve your thyroid symptoms and functions, and then not exposing yourself to harmful chemicals, which are found in our care products, our water, our air. All of this stuff really affects our thyroid as well. So to wrap it all up, Hashimoto's is a very common autoimmune condition that affects the thyroid gland. And yes, it is way more common in women than it is men. And understanding the reasons why women are more likely to develop Hashimoto's can help increase awareness and help us improve treatment outcomes. So if you're struggling with symptoms of Hashimoto's, it is so important to seek medical advice and get an accurate diagnosis with proper treatment and management. And it's possible to improve thyroid function and reduce symptoms even before medication is necessary. I have a thorough thyroid blueprint that can help you actually get a thorough look at your thyroid if you're suspecting Hashimoto's or you've been diagnosed with Hashimoto's. I've got that blueprint at checkthyroid.com. And if you think your hormones are playing a role in things, I have a very thorough hormone symptom checklist at checkhormones.com. And feel free to ask any questions, ask me anything, comment below, and I